So what we're gonna do is we're getting ready to do a sterile dressing change. And I have my sterile dressing set up. I'm trying to follow the principles of sterile technique. I have my bedside table up above my waist to prevent picking up any germs on my tape. I've put a piece of tape down first as a barrier between my tape and the bedside table, and then I have my tape ready to go. I got my gloves to take off my dirty dressing first. So what we're going to do first is we would come in and introduce ourselves to the patient with basic care and comfort to see if they're ready for the procedure. If there was anything that was going to be painful, we would offer pain medication. We're going to put on just a pair of clean gloves first. And when we remove a dressing from a patient, you want to start, just find you a corner or start at the end, and you want to try to lift it away from the patient's face so that you can kind of see what's on here, but maybe so that they can't. And I would look at that dressing. I would look to see how much drainage is on it, because we're going to document it in the chart. Is it serous? Is it serous sanguinous? Is it bloody? How much is on there? And I would document that in my chart, and then I could discard of this. Then I would come back, I would look at the incision site. Some of the things that we're looking for is the length of the incision. Sometimes you can use little disposable rulers, or you can even consider your thumb to be about an inch, and you can kind of measure to see how many inches you think it is to document in your chart. You're looking to see if the edges of the wound are approximated and together. So is it healing nicely? Is there any drainage? Is there any odor? We kind of press along the edge of the incision a little bit to see if there's any. Sometimes you can get hardness or firmness called induration. So you're kind of looking, and you want to assess the wound real good so you can document it in the chart. So then when I'm finished with this, I can take these gloves off, and I'm ready to go into doing my wound care and my sterile dressing. So because I'm right-handed, I'm on the right side of the bed, because this is going to be just like the other procedures we've done where we have a clean hand and a dirty hand. And when I open up my sterile packages, I know that I can only open up a sterile field away from me. And so I don't cross over, once I get it open, I have to back off this way. And you'll see what I mean as I start to open this up. So I got 3 packages of 4x4s and an ABD and a pack of sterile gloves. And I have my saline. And you want to kind of pull this tight a little bit so it stays open. And then I'm backing up to the next one. Do you see why I couldn't go now open this one with this hand? Because I would cross over that, right? So I can only go this way. And I keep backing up. And this will be helpful for you to remember too. The first 2 we're going to clean with. The second 2 are going to be the sterile dressing. So we're going to use 1 sterile glove to do this part and 1 sterile glove to do this part. Saline. See why I waited until I got here so I wouldn't have to cross over and reach over? I'm going to open my saline. That's a sterile field. I don't want to cross over. I'm going to palm the bottle. I'm going to lip it, and I'm going to kind of put that out of my way. I got my pack of sterile gloves. decision which hand I want to clean with and which hand I want to put the clean dressing back on with. My dominant hand is my right hand, so I think I'm going to clean with my right hand. So I want to put my right hand on first. And I only want to open this right side because I want to protect this left one not to cross over it so I don't contaminate anything with it. So I'm going to pick up my right glove. I'm going to step back, palm up. Now in this hand, I'm going to get my saline. Come around. And these 4x4 gauzes come two to a pack. And for what we're doing, we're going to separate them. I lipped my bottle already. I'm going to wet my gauze. And we're going to clean straight down the middle of the incision first. Keeping my hands above my waist because they're sterile. Dry with. One thing that you notice about when we do something on this wound is we kind of roll the gauze down. We don't drop it and drag microorganisms. Did you? Mm-hmm. So now I did my cleaning, so I'm finished with this glove. Okay, I can take that off. Now I'm ready to put my sterile dressing back on. So now I need my other glove. I'm going to pinch, palm up, step back. And it doesn't really matter to me. Some people like to lay these down flat, or you can fold it in half. You just don't want, once you lay it down, you want to leave it down. You don't want to keep moving it and drag stuff across the skin for microorganisms. Does that make sense? And then I'm going to get my ABD pad. With the ABD pad, you always want to put the blue strip goes up.
It's like a diaper tell you when it's wet, right? Does it?
Huh?
Does that change colors when it's wet? Or that one doesn't do it?
I don't think
so.
And then I already have my tape. And anytime we do a sterile dressing, we would want to put the date, the time, and our initials on the tape for the next person coming on for the next shift, so they would know that the bandage was changed, okay? And that's it.